me?
And yes, we are live again, and today is day 2. Were you here yesterday? If you were here yesterday, I want to see you show your emojis. I want to see your fire emojis. I want to see you in the live, in the comment section. If you were here yesterday, wow, yesterday was awesome. Yesterday, we had a great time yesterday. If you were not here yesterday, trust me, you need to go catch a replay. You do need to catch a replay. Yesterday was something else. The 2 speakers came with fire, like they came with fire, came prepared. And today, we'll be having 2 awesome women again today. We'll be starting off with Dr. Ezinne, who is a GP in the UK, and she's going to be telling us a lot about women's health. And then we will go on to fashion, because what's a woman without fashion now? Come on. A woman has to come on, show up. She needs to glow like, yes. So Wura will be taking us on fashion. How a woman should dress, dressing as a queen, dressing to glow. So before that, let's have Dr. Ezinne on stage. I want to see you in the comment section. Can I see your fire emojis? If you are here, come on, drop your fire emojis. I want to see you. I want to see you. Welcome, Nena. Welcome, Damilola. Can I see everyone? Can I see? If you are here, drop you. I want to see you in the comment section. Come on, let me see you. Drop your fire emojis. Drop your fire emojis. And so we will be having Dr. Ezinne now. She'll be coming live. So let's hear a little bit. Who is Dr. Ezinne? Get to know Dr. Ezinne.
Erhirre is a child of God, wife, mum of 3 sons, and a plant parent. She works as a GP with the NHS England and the lead medic at Easy Access Healthcare Limited. Her legacy assignment is helping people just like you and I pass through gates on the Easy Access platform. She enables you to live to your 80s without complications of type 2 diabetes and all the long-term conditions that we may worry about on a day-to-day basis. Dr. Ezinne graduated as a medical doctor in 2007 as a class valedictorian and has held various roles in pathology, primary care, women's health, lifestyle, and obesity medicine. She has raised her children to love eating vegetables, especially greens, and to listen and abide to the word of God. With an outstanding ovation, let us welcome Mrs. Dr. Ezinne Erhirre. Woo!
Hey, Dr. Ezinne in the building. Come on, Dr. Ezinne. So one thing that attracted me to your intro, the first thing was plant parents and plant mom, plant parent. Like, oh, okay. I do have a friend that used to always call herself a plant mom, and I'll be like, oh, duh, what's plant mom? And then I got to hear you plant parent. Okay, now. So you're going to be telling us a bit about that part today and telling us about what you do with plants, becoming a plant parent. Like, seriously? How many children, how many plants and babies do you have? You're going to be telling us about that. So, Dr. Ezinne, you have the stage now. I'm going to be going backstage. Come on, give us that fire. Tell us what we know about our women's health. Oh, I can see a fellow plant mom here. Yeah, plant mom. I think I need to be a plant mom. Do I need to be a plant mom, a plant parent, a plant foster mom? I don't know. I don't but I have to choose one part to follow. Okay, Dr. Ezinne, let's have you. Come on. Tell us a bit about yourself, and we want to know how do we glow as women from the inside to the outside? What do we need to know about our health? How can we stay young, trimmed like you? Come on, how do we do it? Have the stage all to you now.
All right. Good day, everyone. Can you please hear me? Can you hear me?
Settings on top. Go to input devices. Input, disable this. Yeah.
Can you hear me now? Such a shame. Can you hear me? Interesting.
Dr. Ezinne, we can hear you very well. We can hear you, Dr. Ezinne. Yes, we can hear you. Yeah.
Okay, good, good, good. I just wanted to be sure I'm being heard. So
Yes,
I
you are
think
being heard
yes,
clearly.
yes, I'm very, very happy to be here to share one or two things. I think women understanding why we are different, what makes us different, will make a world of difference in our health. So I'm just going to, from time to time, be looking at my slide, if that's okay, on what we're going to be talking about. And I really like to meet people that are here. So Coach has spoken a little bit about myself. Yes, I love plants. I think I'm a foster plant mom, and I'm still learning all the ropes. So I really love some tips about looking about after plants. And I also love plants because they make a world of difference. So let's quickly go down to, this is what I currently do. Next slide, please. This is a little bit about me, and I really like to know one or two things about you as well. One of the things that has been a major challenge for me has been stress eating, which is something I know a lot of women can relate to, and anxiety, especially when you're a mom. You're always thinking about, did I do this right? Did I do this right? Second guessing yourself. This is something that I've also had to deal with, especially working full time, parenting full time, marrying full time. The Lord is our strength. Okay, so what makes us women? Let's move on to the next slide. And who is this for? Next slide, please. Who is this for? There are a lot of women. I think we're currently living in one of the best times to be alive as a woman. In the generations past, actually, when I was even in secondary school, we're told that as women we should be seen and not heard. Can you just imagine that you should be seen and not heard? But now a lot of us are coming out of that stereotype. We want more out of life. We know we've been gifted by God. We've been given the opportunities. We have the talents to do more. We want to make meanings out of our lives. And as a doctor, what we're going to be looking at today is, what are the things that can distract women? How does our unique makeup distract us from showing up the best way that we can? Because we want to be more than just, even though that is a glorious calling by itself, but we want to do more than being wives and moms, because there's more we can offer. So next slide. Next slide, please. So what makes us, there's a slide before this one. Yes. So what makes us female? Basically is our genetics. We know this. XX, if you have the XX chromosome, one from the father, your biological father, one from your biological mother, and there's no Y chromosome, that baby is going to grow up to be a female. And the interesting part is that in the womb, in the early months, a baby in the womb, there's no difference. When you look at the external genitalia of the genitals of a male embryo and a female embryo, there's no difference. But if the embryo lacks the Y chromosome, then that embryo is going to continue to grow up as a female. And the major reason being our bodies produce more estrogen, or rather, one of the major reasons being our bodies produce more estrogen than a male body would produce. But our female hormone system is more than estrogen. Let's look at the next slide. The hormones that actually control everything actually starts from the brain, and this is something very important for us to recognize. So on the slide, if you can look at the slide, the gland on your brain called the hypothalamus is actually like the orchestra. It's actually like the choir conductor, if we may to put it that way. At the time puberty is starting, which can be any time from 8 to 12, it starts releasing a hormone that talks to this other gland, the pituitary gland. This pituitary gland would now release its own hormones that will stimulate the ovaries to start producing estrogen. It is this estrogen that would make the female to start developing breasts. Some testosterone is also produced even from the ovaries and from the adrenal gland here just above the kidneys, that will make the girl start having pubic hair in her armpit. The estrogen also influences the female hip size, so she starts developing hips, more narrow waist, and she's not quite as hairy as the male. I'm going to come back to talking about this slide. There are also other glands that also make a lot of difference. Things like your thyroid gland, we'll talk about it later, and even the pancreas. Next slide, please. And this is what our female genital tract looks like. We learned all of this in biology. I believe many of us here may even have a medical background, clinical background. And the womb is behind the pelvic bone. It's actually behind the pelvic bone to protect it. When you're not pregnant, it can be actually the size of your fist or the size of an avocado pear. That's small. And it's beautiful how when a woman is in full-term pregnancy at 9 months, this very small gland can grow very big and get up to just under your breastbone. This is where menstruation comes out from. This is where, I believe many of us are adults here, this is where the male organ enters during sex. This is the inner lining. This empty space here is the inner lining of the womb where the baby grows. This is what also comes out to form during menstruation. And then we have our fallopian tubes and the ovaries. Now, any issue in any of these areas can actually cause issues for the woman. Next slide, please. So for the adolescent female, some of us may have these as our children, as our nieces, as people that we work with. The first sign of puberty in a girl is usually breast development. Sometimes it may be pubic hair that will come first. And if you do notice your daughter is beginning to develop breast before the age of 8 years, it's important that you see a doctor, because it may mean that she's producing more estrogen. And if she starts producing estrogen very early, she may not grow to her height potential. Again, estrogen is one of the reasons why women don't grow as tall as men on average. So you can see twins, boy and girl. The boy very likely is going to be taller than his sister, even though they were born the same time, because his testosterone will encourage more growth compared to the female. So yes, next slide. And one of the things we can do, I'm sorry this slide is kind of overlapped. One of the things we can do to help our daughters at this age is ensure, or if you're a young person watching this, ensure you have a healthy weight. So not underweight, not skinny, and then not too on the big side. One very important thing I want us to take away from here, even if you know this already, is that fat tissue, also the body can produce estrogen from fatty tissue. And I'm going to digress here just in case maybe you don't continue, is that the more fat a woman keeps on her body, the more likelihood it increases the likelihood of her having things like breast cancer and cancer in her womb, because it's going to, that extra estrogen is going to keep on stimulating the breast cells to continue growing. So ensure, thank you so much, Shani Space. Ensure your adolescent female has a healthy weight. And what I'm going to talk about practical things we can do to ensure this occurs. Next slide. It starts in pregnancy. Studies have been done. There's a study that was done in Oxford University and University of California that showed that the fat level in a mother's blood can affect the size of the baby in the womb, the size of the baby's tummy in the womb. And this can affect that size of the baby's tummy even up until 2 years. We also know that what you eat actually goes down to your baby. A mother that has eaten garlic, for instance, or drank alcohol, for instance, you can perceive it on the amniotic fluid. That's the baby water. You can perceive it. So our babies in the womb are already getting influenced by what we eat, and it could potentially influence the appetite. During lactation, when you're breastfeeding as well, the same occurs. This is one of the reasons they say avoid alcohol. And back in the days, this is why many women were also giving palm wine when they are nursing mothers, because the palm wine will relax the mom. The palm wine will also go into the baby and will make the baby sleepy so that the mother can sleep. This is one of the things our mothers that were even illiterate and didn't do any scientific studies, they already understood this. So early in life, you can actually start influencing your child's weight. Some of the other things you can do. Thank you. Some of the other things you can do. Please, next slide. Sorry, next 2 slides. I'll come back to this slide, please. Next one. Yes, some of the things you can also do practically to help your daughters is being a role model. Your children will eat what you eat, even till this my old age. Not old, I'm very small. When my mother is eating something, I feel like eating it. I don't know if there's anybody else that has experienced this. There's something about the influence of a mother over her children. I don't eat fish. I don't like fish. I don't know if I'm allergic to fish. I think I am. I'm not allergic. I'm just intolerant of fish. But when my mother is eating fish, I feel like eating it just because that's it. That's it. We generally will want to eat what our parents are eating. It's difficult for me to tell my child, don't drink soft drinks. Meanwhile, I myself am drinking them. Ensure you usually get fruits and vegetables. And the simple rule about fruits and vegetables, whatever is in season is good for you. So you don't need to try to import vegetables. You may go online and read, oh, this fruit is very good, this very fruit is very good. Whatever is local to you is actually the best, because it means you're going to be able to get it at its freshest forms. Little things we can do in our homes is a healthy swap. So rather than giving your children ice cream, you could put banana in the fridge, especially like during the hot weather, or if you live in a hot country. Put your banana, your watermelon, your pineapple in the fridge. You can mix it with yogurt and let them enjoy it. These are easy ways we can encourage our children to enjoy healthy food. It's common these days. I see a lot of parents say, oh, my child doesn't like water, and then they flavor the water. What you're generally doing is that you're training that child's taste buds to always want flavor things. I've seen adults who tell you that they've never drank water. They can't tolerate the taste of water. It's really our upbringing. For those of us that are in inner circle, Coach Wendy will always say parenting begins with you. And that's the truth. We decide. Is no child, if you have children, unless you give your children lots of money, whatever they eat is actually what you provide. So the onus is actually on us to provide these things. Keep them in the fridge. Out of sight, out of mind. If there's no soft drink in the fridge, they'll definitely have to drink water. There's nothing wrong with eating frozen vegetables. For those that live abroad, there's nothing, because many people are like, oh, I want to buy very fresh and it's very expensive. If frozen vegetables are what you can afford, there's nothing wrong with it. If the pre-washed ones, say you're very busy, you could go for pre-washed or sliced vegetables in your grocery stores, and that's fine. And something to just say here, having a meal plan also goes a long way in helping. One thing I do in my home is that I ensure that my children join me in creating the meal plan, so that we can decide on what we want and what they want. Can we go back to the last 3 slides? I think, yes, last 3 slides. I think the title of that slide, yes, that's the orange, the real orange one, the orange slide, the one before this one. Yes, this one. I brought this comparison here just so that we see the difference between a real orange and fruit juice. Many children these days, many of us know not to give our children soft drink all the time. We know it will affect their teeth. But the mistake we unconsciously make is giving our children lots of fruit juices, because there's that mindset of it's natural, or it's easy for them to drink orange juice in school rather than eat a whole orange. And then, the packaging of the orange juice is always more flashy. Nobody advertises orange, because, I mean, what's the point in advertising orange? But there's usually lots of adverts on juices. And if we look at this slide, looking at the difference between an orange, a full whole orange, and fruit juice, few things I want to highlight. I copied this from healthline.com. If you look at the calories in one orange, is 66 calories. It has a fiber content of 2.8. And the beautiful nutrients in fruits, the beautiful healthy things about fruits, are usually attached to the fiber. You can see the vitamin C content here is 92%. And then it has other good things like folate, which is important for blood cells, calcium for their bones, potassium for many of the chemical processes that go on in our hearts. Now, let's go to the next slide and compare this content with what is in fruit juice. Now, if you look at fruit juice, 1 glass of fruit juice, 150 ml, almost equivalent to what the quantity of that same orange. The sugar content is more, and I wonder how many of us drink 150 ml. I won't. I don't know. I don't have that kind of self-control. I will drink more than that. Then the fiber content is 0.1 grams. The vitamin C is just 38%, way less than you get in a full orange. And then you don't have that fiber. So I know that some juice packets, they add back artificial fiber, or they add some form of fiber, but you're missing most of the nutrients and you're just getting sugar. In essence, when you're drinking fruit juice, you're just drinking sugar and water. Irrespective of how healthy it sounds, it's still best to take your fruits whole. This will go a long way in ensuring that our daughters keep a healthy weight. So please take off those fruit juices from your fridge. Take them off their lunch packs. They don't need it. They don't need it. Regular diet, water, normal fruits and vegetables is all they need. If you want a meal plan, I don't do general meal plans for everyone. It has to be specific to what the child likes and where the child is, depending on their weight and their activity level. If you want that, you can send me an email. Please, on the next slide. you can see my email address and we could work towards that. It's not free. I'm afraid it's not free. Now let's go to the next slides. Next one. We'll quickly run through the next one, please. Yes, we'll quickly run through some of the things that these are unique makeup. The fact that we have a womb, the fact that we have estrogen, some unique problems that we may experience right from childhood to adulthood, and what we can do about it so that we can live normal lives. So the first one here is menstrual pain. Many women experience menstrual pain, and if your menstrual pain starts when you start menstruating at the age of menstruation, and it usually starts on the first few days, that can be normal. It's not always normal, but that can be normal. And in such circumstances, if things like paracetamol or ibuprofen, if it's safe for your child to take ibuprofen, Nurofen is how it is sold in the UK. If it is safe, then that's fine. But if your child is still experiencing so much more pain that's affecting their quality of life, then you need them to see their doctor to find out why. Sometimes, not every time, persistent menstrual pain can actually be one of the first signs of endometriosis. So if your daughter is really in pain, please don't tell her to suck it up. Seek early treatment, just so that we can make this diagnosis early. I'll talk about why making the diagnosis of endometriosis early is important. The next thing that a girl could experience is irregular periods. Now, in the first 4 to 8 years of a girl's menstrual cycle, so say she starts menstruating at 12 years, but even up until 16 to 20 years, her period may still be irregular because the ovary is not yet efficient at ovulating every month. So once you're not ovulating every month, your period will be irregular. In fact, that's one of the reasons why, if you're someone that has ever been to a clinic because you were trying to conceive, one of the things you ask is your period regular, because that can be a telltale sign that you're ovulating or not. So that is not usually a problem. Many people may think because the child's period is irregular at that age, then she may have PCOS. It's difficult to make a diagnosis of PCOS in an adolescent. Yes, we may say this adolescent is at risk, but it's difficult to make that diagnosis at that early stage. A common thing too that girls may experience is pimples, acne. Why? Multifactorial again, but sometimes because their skin is sensitive to testosterone, they may produce more oil. The oil may block the hair follicles and cause acne. Acne can be a major cause of bullying. Teenagers are mean. It's hard to be a teenager. I'm sure all of us here can testify. So if your child lives with acne, please don't tell them to suck it up. Please don't ignore it. There are easy, very accessible, and very effective treatments out there that you can get. You can take them to see their doctor and get these medications prescribed. If they try one and it doesn't work, there are still other options on what can be done. Next slide, please. Another thing, moving on to adults, a very common diagnosis that I'm happy a lot of people are becoming aware of is things like PCOS. And the way we make the diagnosis is very easy. With PCOS, if you look at this picture on the left side here or right side, depending on how you're looking at this slide, but the picture close to my face, if you look at the ovary, a normal ovary should have 1 mature egg per month. But with women with PCOS, they may have 12 eggs, 20 eggs at the same time. And the unfortunate thing is that there's so many eggs, but they are not ovulating. So because of that, like we said before, when the ovulation is irregular, periods will become irregular. So you see some of them, they may say 4 months, 5 months, there's no period. And when the periods now come, it comes torrentially. They have that issue, that woman with the issue of blood. They may experience that. If you're someone that has noticed that your periods are irregular, you're having very few periods in a year, or you've noticed other signs that you have lots of pimples, like we said, the skin may be sensitive to testosterone. That's why even boys too may have acne. Or you're growing facial hair, so there's hair on your face, your chest, it's like you're having beards, or your tummy. Averagely, a woman doesn't usually, she may have hair on her tummy, but it's not usually as much as that of a man. Or your thighs, around your buttocks, you're having lots of hair. This may suggest that you're producing lots of testosterone, and it's important to see your doctor to make a diagnosis. One of the reasons why it's good to make the diagnosis of PCOS early is to avoid the attendant risk factors, which I'll suggest you discuss with your doctor. I want to stress here that if you go for a scan and they find that you have lots of eggs, lots of cysts in your ovary, they may say that this is polycystic ovaries. It doesn't mean you have the syndrome. These other two factors, one or two of these other factors have to be present before we say this is PCOS. So so that you don't panic if you go for a scan and they tell you you have polycystic ovaries. Next slide. Something else very common, especially with African women. In fact, it is said that up to 80% of African women may have fibroids. Having fibroids does not mean you cannot have children. Many women will have fibroids and they'll still go on to have kids. Some of the symptoms you may notice is bloated, so you may feel you're pregnant. And this is one of the reasons why you see a lot of women, they'll tell you they were pregnant for 2 years, they were pregnant for 7 years. Many times because they had fibroids. So they had fibroids, their tummy was big, then pregnancy now entered, and then they calculate all those years of big tummy to be the years they were pregnant. Fibroids, especially when fibroids are located inside the womb, it can cause heavy periods. It can cause women with issue of blood. If the fibroids are blocking, you can see this big fibroid here is blocking the fallopian tube. So when a baby is coming, the baby is usually formed in the fallopian tube. The egg and the sperm, they meet in the fallopian tube. So imagine if a woman has a fibroid that blocks this fallopian tube, has another fibroid that blocks this fallopian tube. In circumstances like this, or when there's so much fibroid blocking the place where the baby may stay, in circumstances like this, it may actually make it more difficult for her to conceive and may need surgery. Depending on the part of the world you are, these days, not all fibroids need surgery. Where I currently live in the West Midlands, they actually have technology that uses things like ultrasound waves. It's got radio frequency waves. It's called Sonata to deal with fibroids. So women don't need surgery in such instances, especially if you're trying to conceive and you don't want surgery. You can actually discuss this with your doctor. Even in Nigeria, for those of us that are in Nigeria, this technology is actually available as well. So lots of good news, lots of advances going on in science, even if you do need surgery. And I'm just going to say this as a way of causing deliverance for somebody. There are some women that have fibroids. I've been part of a surgery where the fibroid was 40 kg. Now, a newborn baby, even big babies, is 4 kg. So imagine someone carrying a fibroid of 40 kg. I think I've seen another one that was 19 kg. So that woman was carrying equivalent of up to 5 babies. That was the weight of her womb. Now, that womb is not likely to get pregnant. There are some women that have very bad fibroids that messes up everywhere, that they are not likely to get pregnant, even with IVF. So why am I saying this? That if you see your doctor and they tell you you have fibroids, you speak with a specialist and they think even with surgery you may not conceive, you should ask that question, because it's a very difficult thing to tell someone that, oh, look, because we hear testimonies of someone say the doctor said I wasn't going to get pregnant and I got pregnant. With fibroids, many women will still have children, but there are certain cases where the whole womb just gets so distorted that it's difficult for a baby to stay there, that even when they get pregnant, they are very likely to have miscarriages. So in such circumstances, surrogacy may be the way forward. And let's just go to the next slide as I talk about infertility, because that's something that a lot of women have seen. Next slide, I'll come back to this one, please. Now we're talking about infertility. Let me just finish talking about it. I think this is one of the biggest challenges a woman can ever face. My first love in medicine was gynecology, but I didn't do it because I didn't think I was going to be able to withstand the pain in people's eyes when they are struggling to conceive. I think it's one of the worst crosses, one of the heaviest cross a woman can carry, and finding it difficult to conceive. But I also say in circumstances like this, it's important to know your facts and be prepared. Be prepared. Some women will get pregnant with just ovulation induction. Some women will need IVF, which will cost thousands of pounds, millions of naira. And some women, the best option will be surrogacy. So speak with someone, a specialist that you trust, and go with advice so that you can have your children early and move on with life. I used to know a lady that I've known people that their life has basically halted because they were in the process of trying to conceive, all that back and forth of hospital. So they stopped everything, they stopped working. Of course, we do know that these things can also affect the strength of marriages. So seek help in such circumstance. Let's go to the other slide before we move on. The slide before this one. Can we please go to the slide before this one? Yes. Not this one. Sorry, you were in the right slide. The one on STIs. Yes. Just to bust a myth here about thrush and staph. Thrush, a lot of people think thrush. Thrush is that one that causes that thick discharge that itches, that usually doesn't smell and it itches. And there's this common thing of staph. A lot of people keep on treating it up and down and say they have toilet infections. These are not sexually transmitted infections. Staph is a common microorganism that is found in a healthy vagina. So it is not an STI. And this is why it is very easy for these fake people to cash out on people, because it's like someone treating me because I have a nose. Of course, I'm going to have a nose. It's like someone saying that you have sickness because your teeth, your permanent teeth is not as white as a baby's own. Of course, your permanent teeth, for most people, your permanent teeth is not going to be as white as a newborn baby's, as your infant, your 1 year old with primary teeth. So staph is natural. Thrush needs treatment, but it is not an STI, so that you don't start suspecting your spouse of cheating. A common thing that affects women is STIs. I know we and even married women have STIs, because some people feel, oh, this is sickness for 15-year-olds and 16-year-olds that are loose. You don't need to be loose to get an STI. Just one sexual encounter, even with your partner that is infected, can cause an STI. And many people, thank you for putting this up, and many people there are certain STIs that can stay in your body for years. So say your partner, your husband, for instance, because many men usually don't have symptoms. A man can pick up chlamydia, he can pick up HIV when he's 27 years. Then he marries you when he's 35, 31 years old or 33 years old, and he infects you. Even though while both of you were together, he has been faithful to you, and vice versa. For women, this can cause symptoms like pain during sex. It can cause a foul-smelling discharge that looks like pus. It can also cause stomach pain. Again, it can also cause infertility, because things like chlamydia will block your tubes. It can block the woman's tubes. So this is why, if you're sexually active, from time to time, you can actually get screened for STIs and get treated immediately before it starts causing chronic pelvic pain or causes infertility. Even as a man, it's important to get screened. If you live in the UK, you can actually order test screens online. Yes, you can order test screens, test kits online. It will be delivered to your home. You discreetly do your test. You send it back by post, and then they send you back your results to avoid stories that touch. If you're watching from anywhere outside the country, if you ever suspect you have an infection, please don't go to someone that tells you it's staph and starts giving you nonsense antibiotics that don't work. Get properly tested and diagnosed and properly treated. Yes. Next one. Next one. Now, there's something I just thought about. I think this morning it came to my mind before we talk about menopause. It's also talking about, I think we've talked somehow about contraception. I'll just summarize by saying, see your GP to discuss what is best for you, because your health condition is going to determine what's the best contraception for you. But something here I want to state is about breastfeeding. If you live in the UK has one of the lowest rates of breastfeeding, and it's not unsurprising. I mean, it's difficult without childcare, you're not sleeping and all of that. But if someone can comment in the comment section, what's the common reason why a lot of women don't breastfeed in this day and age? What's the common reason why women don't breastfeed anymore? Can someone comment what are the common reasons why breastfeeding is no longer popular? I think some people have said, the difficulty of It means you have to always be the one to feed your child. It's going to be difficult for your partner to feed the child and for you to sleep. Then it also means you're carrying the child everywhere you're going because you need to breastfeed the child. But I think we know that that is a challenge that can be surmounted, in the sense of you can express breast milk and your partner can feed. You can express breast milk and give for somebody else and go on a ladies' night out, go to church, go for a night vigil, go to work, and somebody else can feed your child. Breastfeeding your child protects your child from a lot of things. Your breast milk naturally contains antibodies that is like you're immunizing your child against lots of germs. You're making it's going to go a long way. This is a very good point. This some are not lactating well. It's going to go a long way in protecting your child from a lot of common infections. It's going to also help you lose weight. You know that if you're exclusively breastfeeding, in one day you could lose 500 calories. To burn 500 calories in a gym, you have to be very motivated. So naturally, you're going to lose weight with breastfeeding. And then I find it easier because it means if I'm going out with my child, because me, my leg tired, my leg, I dey like to go out. I can easily just carry the child. And I know if the child is hungry, look for one private corner and breastfeed. I mean, anybody that is staring at me, we're going to stare at each other. Now, someone has said something very important about not lactating well. If you live in the UK, there are breastfeeding consultants. Even your health visitor can signpost you to breastfeeding consultants that can actually support in such regard. Sometimes, especially in the first few weeks, some people think they're not lactating well, but they are. It's just that it's difficult to quantify. Or sometimes the child is crying and they may feel that the child is not feeding well. The objective way to know, I'm so happy you've written this. Congratulations. I'm really proud to see moms breastfeeding because you're doing your child and yourself a world of favor breastfeeding. Now, I've lost my train of thought there, but I'm not menopausal. No, I'm not menopausal. What was I saying? I've lost that train of thought. But as much as possible, as much as is in your power, we do know that there are certain health conditions that can mean that the mother is encouraged or can't breastfeed. Yes, I was talking about the objective way to know if your child is really getting enough milk is by weighing the child. If you weigh your child and you see that the child is growing, it means the child is breastfeeding, is getting enough milk. Because sometimes when maybe mother-in-laws, your mom may come, I know my mom challenged me a lot of times that this child is not getting enough food. I did exclusive with my first child. My second child was when there was Ebola. I was living and working in Nigeria there, so I had to stop. And then for my third child, I was able to exclusively breastfeed as well, even combining with work and everything. Now, everybody's grace is different. I do appreciate that. But if you can, it's a very good idea to breastfeed it. To me, I'm going to be very honest. I did it for selfish reasons. I did it to lose weight. And that was it. And I was working in pathology then. I saw lots of young women coming with breast cancer. So that was a motivation for me to also, because breastfeeding your children also reduces your risks for breast cancer. Yes. So now moving on to older women, to our moms, to our wise women that are getting menopausal. Menopause is simply your period stops. We say perimenopause if you're still having irregular periods, but it has not totally stopped. But we say menopause if the periods have stopped totally for up to 12 months. And it's something that will happen to everyone. After a while, the ovaries would get tired and then they will stop producing estrogen. There will no longer be ovulation, and then the woman's periods will stop. For some people, they cope with it well. They don't have any symptoms. But some other people, they have very bad internal hits. If I were menopausal, I would not be able to wear these jackets. You see them, they are always hot. That hot flushes. It can even stop them from sleeping. It can make them irritable. I've seen someone that said she was so irritable and became very intolerant of her husband, and little quarrels escalated and they had a divorce. So yes, for some people, menopause can be that bad. They are screaming and shouting at everybody, even at work. They are no longer quite as patient. You may start having joint aches. You may start having dryness in your private parts that can increase one's risks for things like water infections, UTIs. It may make sex painful. You see a lot of women, they'll come and tell you that their husband is cheating on them. You ask them why, you say sex is now painful. It's all menopause, and this is something to be expected. So if you have your mom or your elder sister, or you yourself is always complaining of internal heat. In Nigeria, they call it internal heat, and you see them every week they are treating malaria, typhoid that does not want to go. And some of them take a lot of injections that end up causing its own attendant side effects. So in such circumstances, that internal heat, it can be treated. So women will need hormone replacement, meaning they need the estrogens to be given back if their health history allows for that, to help them have some quality of life. I'm wrapping up. The next slide is talking about type 2 diabetes. Next slide, please. Which is actually a hormonal disease. This is my area of interest. Diabetes is actually a hormonal disease. But to be honest, or to be more encompassing, even though the underlying factor is insulin, either there's insulin is not usually what's happening in type 2 diabetes, especially initially, there may even be so much insulin. It's just that the cells, I say the cells are now deaf to the insulin, they no longer respond to it. And a common thing too that increases one's risk of type 2 diabetes is obesity. Again, coming back to why we need to have healthy weights. And from a family where father, mother side, there's lots of diabetes, where we inhale food and then we add weight. So it's something that has also been a personal struggle for me. And I've also mentioned that I'm someone that likes to stress eat. And if you are in that table, if you're in that WhatsApp group, you know that when you are stressed, you can finish a bottle of granola, you can finish a loaf of bread. We're not judging anybody here, but we know ourselves. And these are some of the things that can happen. So many women, when they are getting more mature, initially your body will endure a lot of things. It can tolerate a lot of things. And after a while, it just gets tired and the blood sugars can start rising. I've done a video on my Facebook page on symptoms to look out for diabetes. So I would not go into that here. If you're pregnant too, African women, if you're an African woman, we are also prone to having diabetes in pregnancy. So this is something to actually get tested for, so that treatment can be started early. And then lastly, on the last slide, I hope I've not overshot my time, is to talk about sleep. Many of us here don't sleep for many reasons. It could be work related, it could be stress related. You're having lots of challenges, personal relationship challenges, and sleep has now gone out of the window. Or maybe you have young kids, so it's difficult for you to sleep. I just want to emphasize here, especially for those of us that do night shifts, that when you're working, when you're under stress, your body is already producing stress hormones like cortisol, like adrenaline. And one of the things those hormones do, I'm just reiterating because I know a lot of us know this already, is just for you to talk to yourself. One of the things those hormones do is that they already raise your blood sugar. So if when you go on your night shift, you're drinking hot chocolate, you're you're eating biscuits, or you're eating food. I see some of my colleagues even order food, full food at night. You're actually making things worse. This is one of the reasons why it has been proven that people that do night duties actually are more at risk of being obese, they are more at risk of diabetes, and the attendant consequence of all those things. So please, on your night shift, water is fine. A cup of tea is fine. A cup of coffee, if you're a coffee person, is fine. You can decide to eat your meal. So when you come back from work, you eat before you go to work, or maybe around 4 o'clock, you eat, and that's it. I know you're stressed. I know you've been on your feet all day, but you don't, unless you're someone that is really underweight, but you don't need that additional food. So you don't, at the end of the day, when you're about to retire, because it's very painful. We see this a lot when people are now retiring and they spend their retirement in the hospital, going on the road, going for one hospital appointment to the other. So please, and if that's one thing you take away from today's teaching, please avoid eating at night when you're working, because you don't need that food. You don't need it unless you fasted throughout the day. But if otherwise, you don't need it. So this is where I'm going to end balancing the effect of our hormones on ourselves. Again, one of the things cortisol does, still talking about sleep, is that it can make you insulin resistant. So it means you will not get, it can, especially when you're someone that works in a very stressed environment, you may find that you're feeling hungry. Again, it's just hormones. It's just your metabolism making you feel hungry. If you objectively can remember that you ate in the night, say you ate by 4 o'clock, believe you me, you're not that 10 o'clock when you're having cravings, you're not hungry, you're just looking for something to use to relax yourself. One of the things we can start doing is ensuring we don't use food as our comforter. Food is not our comforter. If you struggle with eating, with stress eating, then there are other alternatives, which I'll do some more content on my Facebook. We'll do some more content on managing stress eating, because this is something that I've dealt with. I had diabetes when I was pregnant for my first child, and that pregnancy was a tumultuous pregnancy. And I ended up eating as if I was going to die. And it wasn't surprising with all the pregnancy hormones, with all that food. It wasn't surprising. By the time I was getting to 8 months, my blood sugar was high. So thank you very much. Do we have any questions or anything that anyone needs me to clarify?
Dr. Ezinne, can you hear me?
I can hear you now.
Oh, I've been talking and talking. Oh my, bless. Okay, so sorry. Thank you. I'm just going to recall what I've said initially. Okay, so I was talking about meal plan. You talked about meal plan. I said meal plan is very, very important. It's very important for us to have a meal plan. Develop a meal plan and ensure that you develop it with your children, just as Dr. Ezinne has mentioned. Get your children involved. And that's part of the reason why we created this lunch guide for children. You can get it up on Seller. Another thing which I did want to talk about, which you mentioned, is juices. Now, two things. So, store-bought juices are not really juices. They are concentrates. Most of them are concentrates. When you go to buy a fruit juice, any fruit things you go to buy, ensure the first thing you look at is the label. Go to the back and look at the label. Look at the label of what you are buying. Is very, very key. When you check the label, what ingredients come first? For most of them, what you will see first is sugar. The next thing you will see is water. The fruits that you think you want to buy may be the last thing, or maybe in the middle. And in labeling, as a food scientist and as someone that's worked in food industries, when it comes to labeling, the first thing that comes first, that means that thing is the most ingredients that you have in that product. So if you have sugar and if you have water as the first thing in that ingredient, that's telling you that that product is comprised of mainly sugar and water. So you are going to be getting very little fruit juice or even no fruit juice at all. Yes, you won't really get juice. So please, when you go to buy your, do not buy fruit store. Take it as just maybe treat once in a while, but do not take it as a thing you have to be buying store-bought fruit juices. Get your fruits yourself. Make your fruits yourself. Another important thing is ensure you do more of smoothies than juices. There is a difference. Smoothies have the fiber in it. It has all the nutrients in that fruit. But when you do juices, you've taken out the fiber content. You've taken out nutrients that are contained in the fiber, and you're giving yourself just the sugar and the water. I know one thing juice does. When you drink a juice, it just goes straight into your bloodstream. But when you take smoothie, it holds you up with the fiber content. It holds you up. It is like a food that you're giving to yourself. So ensure that you make mainly smoothies than juices. I hope we understand what that's the difference between those fruit. So another thing I wanted to just point out, someone mentioned, you talked about breastfeeding, Dr. Ezinne, and you mentioned about, someone dropped a comment and she said she gained more weight. She gained more weight when she was breastfeeding. Now, this is actually why you gained weight. You were eating for not just 2, you were eating for plenty, maybe 3 or 4, even more. Yes. So when you are breastfeeding, the trick is your body, God has made our body so special that our body can actually, we have what we call adipose tissue. Our body has already stored some certain things, that there's already stored some certain nutrients, some certain food for you. You know how a goat will eat and he has some compartment. God has made our body. So if you eat normally, as you eat as you should, you would lose weight. But if you're eating for 3 and 4, sorry, you will not lose weight. You are going to you will add more, because you're telling yourself, your brain is also telling you, you're telling yourself that, oh, I'm breastfeeding, I need to eat more. And the more you're eating every 1 hour and you're breastfeeding, you're not going to lose weight. You won't lose it. You are going to add it. So that is, if you want to lose weight when you're breastfeeding, do not overeat. So now we're going to move into the question section. We have a few minutes. We're going to move to this question. If you have questions, please, can you drop your questions in the comment section? Drop your comments in the comment section, and we are going to come back to that in 2 minutes. Before that, let's just listen to this. Hey, Queens! So I've brought good news for you. So you know what? On the 1st of November, we will be having this event dedicated for you, for every woman. Yes. And you know what? This event is an event like no other. We'll be having great lineup of speakers like Coach Wendy, #1 African parents coach. For those in TIP, you already know how we run it, right? You know. And for those in MMP, Masterpiece Women, Coach Wendy is coming with her fire, like she's coming with her MMP vibes, bringing that fire. She's not coming to talk about parenting here. No, it's about you women, because we are special. Yes. And this conference is for you, that woman that wants to become a better version of herself, that woman that wants to glow, that woman that wants to thrive. In the midst of all her troubles, she still wants to stand. She still wants to grow from the inside to the outside. And not just Coach Wendy, we'll be having Pastor Modupe Afolabi. She is one powerhouse. This woman, this 60-year-old that looks like a 30, you need to come and see her. Trust me, you need to come and see her. She's going to be talking to us about aligning our faith. Because you know, what affects the physical starts from the spiritual. So we are going to also be addressing the spiritual, aligning our spiritual and our physical, so that we can glow properly from the inside to the outside. For women that are so busy, or women that you have special needs children, and it's just like it's so much for you. Tola Andu is coming. This woman has raised a child who has been autistic. Now, Kevin could not talk till he was like 10 years old, yes. But Tola, in the midst of all these troubles, was still thriving. Thriving as a mother, as a full-time employee. Yes, she's a professional. And raising this child. And this child has grown to become a handsome young man. How is she doing it? So you that have been shouting, I'm overwhelmed, hey, motherhood, I'm overwhelmed. Come to this conference. Come and hear from women that are not just thriving, but women that are glowing from the inside to the outside. Register for this conference. I want to see you there. Okay, thank you. Okay, thank you, everyone. Okay, we do have some questions in the comment section. And Dr. Ezinne, you here?
Yeah.
Okay, we have some comments in the comment section. Before we go to these comments talking about menopause, I just want to talk. There's someone asking a question about GMO foods and organic foods. This is a very, very big topic. It's a very big topic. But as much as possible, if you can, buy organic foods. So if you go on shops and you see organic fruit label, just buy organic. So, but this particular topic is we can't cover it in 5 minutes. So I'm sorry, we may not be able to dive into it as we should, but it's something that we'll have in our upcoming live session. So please kindly subscribe to this channel, and we're going to be talking about this very, very, very soon. Yes. So I want Dr. Ezinne to answer this question. So how can a 37-year-old woman prepare for menopause, Dr. Ezinne?
Yes. So yes, that's being very, very proactive. If your periods are still, it's something that is going to happen to all of us. Our ovaries are going to stop, menstruating, and we'll have peace of mind. You're no longer worried about whether you're wearing pad or not. The main thing is maintain a healthy lifestyle. If you live in the UK, by the time you're 40, the NHS also provides this 40-year-old health check, which is really looking at your blood pressure, your weight, and all of those. That's a very good opportunity for you to do your blood test, check your weight, maintain a healthy weight. I talk a lot about weight because maintaining a healthy weight goes a long way in helping you prepare for menopause. Now, this is me just talking from the medicine side of things. Of course, if you're not like what Coach Unique is also talking about, if you're not happy as a woman, by the time you get into menopause, regrets. Imagine many people going to adulthood, going to their 40s, 50s, and they are full of regrets because of the things they have not done. So one of the ways to also prepare for menopause is focus on living a fulfilled life, which I believe you're already doing anyway. Living a fulfilled life, because that will give you that sense of fulfillment, that sense of achievement that you've done well for yourself. So that's how I'll say you should prepare for menopause, being healthy. Generally, I think someone asked a question about are there fruits that can heal fibroids? There's a lot of scam. There's a lot of I'm going to say this very frankly. I'm a very proponent of eating healthy, your vegetables and that, but there's a limit to what those can do. A lot of people will spend thousands of I've seen people that is by the time they are 45 that they now say, okay, I want to come to hospital. Then nature has already now taken place. They're already getting close to menopause. And then it now be the treatments that should have been 1 million naira. You're now going to spend millions trying to now get hormone replacement. It just makes everything a mess. So for anyone having fibroids that are causing issues, please get specialist help. We now have treatment that don't require surgery, depending on where and the size, where the fibroid is in the womb and the size. If you do need surgery, if you need all these other treatments, it's better to have faith, gather your money and go and do it than you are drinking this one, drinking lemon. People are some drinking lemon, they are putting hot water on their tummy to press no. There's no one particular fruit that will melt fibroid. But still saying it again, the fibroid, the female hormone, your estrogen feeds fibroid. So the more fat you have on your body, again, is going to feed the fibroid. It's going to make the fibroid cells even grow bigger. There are some contraception that you can also use that can help to shrink the size of your fibroid. So again, see a specialist to get help in that regard.
Thank you so much, Dr. Ezinne. Now we've come to the end of this session. We need to go to the next session right now. Thank you so much to everyone. Someone is asking about diet plan. Join the Trim and Glow tribe. So follow us on the Foodie Fit Woman on Instagram, on YouTube, subscribe to the channel, and on Facebook. Send a DM on Instagram. I'm going to answer that question to you. So you need to join the Trim and Glow tribe. It's a tribe, yes. So thank you so much, Dr. Ezinne. It's been such a pleasure to have you on this channel. Thank you. See you next time. We're gonna do more lives together. Okay, so now we are going to be moving on to Glow, Dress to Glow. So I'm going to end this now, and please, I give you just 1 minute. Log back in for the next session. Thank you, everyone, for joining. Have a great day.